Welcome. Today we're going to talk about how to use a pediatric gait belt safely and how to do a sit-to-stand transfer safely. Please read all the disclaimers on this first slide and make sure you familiarize yourself with your equipment. If you have any questions, you can always reach out to your physical or occupational therapist for clarification. Using a gait belt is always safer for patients of all ages when transferring or walking with patients. It is much safer than using clothing or body parts for stability. Here shown in this picture is a pediatric gait belt. This happens to be a padded pediatric gait belt. The tag is on the bottom, and it actually will be placed on the child with the tag facing out. You're going to put the gait belt on the child so that the loops are facing upward and that the clip goes together easily with no twists. In order to get the gait belt tight, you're going to need to release it from the Velcro and tighten nice and tight, just like you would a standard seat belt. What we want to do is make sure the gait belt is nice and low on the pelvis and that it's not going to slip down. So you give it a tug down. If I give it a tug up though, it might slide up, which means I haven't put it low enough on the pelvis and I also haven't tightened it enough. So we're going to go at it again till we get it right. It's really important to get the fit of a gait belt correct. Now I have it a little bit lower on my friend's hips. It can still slide up a little bit, which is okay, but sliding down is a definite no-no. We just tighten and pull and tighten and pull until we get it the way we want it. You can see from the back there's many loops. And as you pull up, you want to make sure that there's no fraying anywhere in the system. Now we're going to go over how to do a sit-to-stand transfer.
To the edge.
You want to bring your friend close to the edge of the seating surface that they're on. Please refer to the I'm Still Standing video for information on how to perform this transfer if a child is in an activity chair. What I like to do is I like to block the tibia or the lower leg with my lower leg, grab onto one of the loops right above the child's pelvis, and I'm going to bring him forward and up. This child happens to be able to perform a stand transfer on his own, so we're going to do it again. Notice how I slid him forward slightly so that I could load those quads and those upper legs to get him to go up. I block that lower leg also to keep him from sliding forward. Thanks for watching.